Early in the pandemic, we decided that it's likely the campus would need testing capacity, and we realized that we could do testing significantly more cost effectively than other people that were charging at the time over $100, $120 a test. We could do it for about $15, $17 a test. So I put together a proposal, calculated out how many tests the campus was likely to need, translated that into how many millions of dollars we might save by building our own testing center, and then presented that to our chancellor. And so little by little we started ramping up from the first days when we did 96 assays a day, and we are currently able to do 5,000 tests per day. Each one of these robots does 400 tests at a time.
After it puts this plate on the magnet, it does what we call a fist bump. And it basically makes sure that plate is sitting in place by bumping it down with the paddles. So the prepared plates get passed through the window, and then they get loaded onto one of our 4 biorad analyzers.
As this was evolving, I did write a grant to the state DPH. They asked us to expand the testing capacity off campus and provide regional testing for every citizen of Massachusetts in the area that walks in the door and asks for a test. And so we have become a Stop the Spread center. We've now done many tens of thousands of tests for residents of Massachusetts, and we are in receipt of $5 million grant. This is where the hundreds of samples coming in and are then entered into our secure computer system. The rate of vaccinations is now really dramatically increasing. It clearly means that viral testing need is going to be decreasing. And then beyond that, once you've been vaccinated, are the antibodies you're making able to neutralize virus? That's another question to be addressed. That calls for a much more complex assay that's called the neutralizing antibody assay. A state DPH reached out to us and asked if the assay was ready, and when we said yes it is, they gave us a second contract to become the site that does surveillance testing for antibodies for the whole state of Massachusetts. And just the demonstration that this large organization can pivot and provide testing and now vaccination, not just for the campus, but for the region, I think has redefined how people think about UMass.